And welcome back to Punchline. Thank you for staying with us. President Uhuru Kenyatta is expected tomorrow to convene an extraordinary meeting of governors that is, among other things, expected to deliberate on the status of county preparedness in the wake of COVID-19. And joining me now via Skype is the Secretary General of the Kenya Medical Practitioners and Dentists Union, Dr. Chibanzi Mwanchoda. And welcome to Punchline.
Thank you, Anne. Hope you're well, keeping safe.
I am keeping safe, thank you, and I hope you are too. I guess we're all just doing our best right now. So let's start with what issues are those that concern health workers the most going into tomorrow's meeting between the President and the Council of Governors?
Yeah, so I think first is to appreciate the fact that there have been efforts towards ensuring that health workers' welfare is taken care of. We are aware of their directives that were given earlier on by the President. But more importantly is that up until now, we're yet to see the implementation of all these directives. And then to also appreciate the fact that we have an acute shortage of healthcare workers in this country. That shortage has been for decades. And with COVID-19 pandemic, what situation we got ourselves into as a country was that we had to redistribute the workforce that was currently in place to be able to take care of the COVID-19 patients. So that means that from the beginning, then what we had was the fact that we are beginning at a point of a disadvantage of being stretched with regards to offering services, not just for COVID, but even for the normal ailments that we that present in our facilities. So the issues that the health workers and even as KMPDU as a doctors union feel strongly, and these are recommendations we've made now, is one on the issue of occupational safety and health. And occupational safety and health is broad because this is what determines with regards to your work environment. Is it safe for you? Given the high infectious nature of COVID-19 disease, is that basically what it means is that the work environment has to be the health worker to be able to do their duties as required. So first thing is, of course, the provision of personal protective equipment. And on this is first to appreciate Equity Foundation and the Kenya COVID Fund that has come through as to ensuring that there's provision of personal protective equipment, the level 3 PPEs, the full kit PPEs for the COVID-19 designated facilities across the country, almost 72 of them. So that's a good effort so far from and an improvement from where we were when we began. But more importantly now is that there's a gap and there's need for a shift with regards to personal protective equipment provision.
Right.
First is that we have the level 2, which protects your areas of disease transmission, that is the eyes, nose, and the mouth, and the body. So here we require goggles, we require N95 masks, and N95 masks, goggles, and face shields or goggles, and of course also what we call the surgical gowns in case of body spillage and for patients. The high risk areas. Secondly, also in the level 3, level 2 facilities, remember that the disease is now widespread across the country in almost all the counties as we speak. So that means that all these, and with the community spread, it means patients coming into facilities could be COVID-19 patients, asymptomatic, but then also transmitting the disease without. So that means the health workforce has to be protected fully at this point in time to reduce the number of infections of healthcare workers we've seen. Of course, as of 22nd of July, which is 4 days ago, the number stood at 558 of healthcare workers infected with COVID-19. And if it continues, then we might not have the requisite number to be able to respond to this pandemic. Secondly, of course, is to beef up the numbers and reinforce through employment of more healthcare personnel. Yes, there are directives on that, but these healthcare personnel are yet to be on the ground. And as a result of the infections and then the redistribution that I talked on about earlier, then all our healthcare workers currently are very stretched. There's burnout setting in, there's fatigue, there's also the aspect of the mental health and wellness of our healthcare workers, which is a very stressful condition. So here we're looking at psychosocial support that is very important for our health workers. elaborate structure of how our healthcare workers are being supported psychosocially, counseling, debrief sessions, all these are required in the facilities. And then the other issue that now is a very thorny and one that is affecting the morale of healthcare workers is the issue of their welfare with regards to right to treatment. That is the provision of insurance for their treatment. And secondly, compensation should one get the disease and die. And we have already lost a number of healthcare workers, 8 at the moment. Right. One doctor for us is KMPDU who died. And up until now, what we are not sure about is what happens to the family, what happens to the children of our late doctor.
Will there be compensation?
As it is, there's no structure to compensate our healthcare workers.
Right.
And that is very important and critical at this point in time.
Okay, Dr. Let me pause you there because we are running out of time, and also we're having a bit of a challenge with the connection, but we'll press on just a little bit more. There is a raging debate, it appears now, on who should be at the front line of managing this pandemic, whether it is national government or whether it should be counties. And you have seen in some very subtle way, national government intimating that, hey, look, health is a devolved function, so counties, what are you coming up with? What do you, intend to do? How do you think a pandemic should be managed? Can counties handle this on their own? Should national government really just stick to its constitutional role of policy?
Yeah, so where we sit, and given the magnitude of the pandemic that we have upon us as a country, and appreciating that, yes, health is devolved, but it is a shared function with responsibilities between the national government and the county governments. But given the magnitude and given the effects of what we are seeing at this point in time, nothing stops the country to be able to have this pandemic managed and coordinated centrally at a national level. And that does not mean that counties will be left out. Counties can equally get representation in this level of management. And at this point, just look at countries that earlier on in this year who were dealing with the pandemic, countries like Italy, Spain. At some point, they had to even nationalize their private facilities, private hospitals, so that they were able to respond adequately to the needs of the citizens of their country with regards to their treatment, so that we quickly be able to control this situation. Because as it is, the directive to have 300-bed capacity facilities being put in place, 2 months later, we are yet to get to 30. 47 counties, I think, as of 2 weeks ago, we were at almost 26, 27 counties. We are ready to get to the 47 counties. And the second thing that comes into place with this is what about the human resource component of it? Because beds, equipment, ventilators, putting in place oxygen will not treat the Kenyans that will be presenting the facilities. You need equally the number of health personnel required to be able to treat these people. So basically, it means that you need a central and coordinated. And at this point, and it's not to say that you're undermining devolution, it's just to say that for the sake of this pandemic, let us have a nationwide approach, and let us have this function at this point in time of responding to the pandemic be managed at a central level, at the national level, and let the counties have their representation in this, so that they are able also to equally make sure that the counties are well prepared to handle the pandemic.
Right. You're talking about that central management, and indeed, I suppose that is what tomorrow's meeting hopefully should, resolve on a more coordinated plan with the counties. Yet people are asking, where is that big plan? What happens if we get the kind of numbers that we're all praying we do not see? What is the plan? What should be the plan? What should that coordinated national and county government effort look like very practically in terms of setting up of facilities or shared resources? If you could give specifics, what should be on the table tomorrow?
So the first thing tomorrow is to do an audit of the bed space that was required across each county. And secondly, once that is set, then you equally not just the bed space. Second thing is to look at the equipment level. Of course, we need ventilators, we need oxygen supply, and do we have oxygen enough in each and every county? That means that over the last, and this is to appreciate the fact that earlier on in April, even the Council of Governors appreciated that our healthcare facilities were dilapidated, not to be able to respond to the pandemic. And so 4 months later, what has been done so far and what should be done going forward? So you have the infrastructure part of it. And the second part is to ensure that an elaborate plan is put in place, that the recruitment of healthcare personnel across the counties, of course, looking at the disease burden, is put forth, and at this point we have to agree that the summit has to make a declaration with how they're going to engage human resources, the numbers required, and making plans, put in place plans for if we do get to a point where our capacity is overwhelmed, then how do we get more additional healthcare workers? Countries like Italy, Spain, Germany, France, earlier on in the pandemic, when they were at their peak and were unable to have enough healthcare workers, looked back and looked at their final year medical students, final year clinic, because it's just to handle the pandemic, because at their final year, most of them are equally capable of handling the basic with regards to COVID-19. Given that we have had 4 months, there's been a lot of education training, especially on COVID-19. And then thirdly, of course, is to put in place the resources. And we know there's always this conflictual relationship between the national and the county governments with regards to resource sharing and all that. At this point in time, I think our interest as a country should be one, that is to respond to COVID-19 as one country, not one and not two levels of government. That means as one government of Kenya. And at this point in time also, appreciating that, then all efforts have to be towards that. We should not be at this point also seeing this conflictual relationship playing out, because it hurts the response. It hurts the response with regards even to how human resources for health are engaged, with even how we invest in the healthcare system. And the other thing is that this is the opportunity for the country to be able to strengthen the health system. Not just for now, but even beyond the pandemic, because every investment you're putting towards, the pandemic will come and go. But after the pandemic, our system should be much better with regards to service delivery to all Kenyans at this point in time.
Absolutely. You know, it could be the place where to work on the legacy projects, fix the healthcare system once and for all. Thank you so much, Doctor, for speaking to us. All the best to you as KMPDU, and of course to all medical workers who are saving lives right now. Thank you for speaking to us.
Thank you very much.
All right, time for us to take a short break. On the other side of this break, we now turn to the governors. What are their expectations tomorrow? Governor Peter Anyang' Nyong'o joins us on Punchline.